Yeah, it's happening.
They didn't give him a job.
After they check this out. Yeah, whatever. My sister's water gets really hot.
You ready? Okay. Can everybody hear me okay? Perfect. I'm Stephanie Rosland. I'm an advisor at the Wilson Agency. What I'm going to go through with you today is your benefit plan for the year 2016 through 2017. Your benefits are on the plan year of June 1st, 2016 through May 31st of 2017. Just because your benefits run on a plan year that's different than the calendar year, your deductible with your medical and your dental, those all run on a calendar year. So just keep that in mind. It's a little bit different here. So some of the things that we're going to go through today is understanding your medical coverage. We're going to do just a brief overview on that. You do have a different medical and dental carrier. We'll do benefit plan overview, and then also your new rates and your premiums. So right now we are in open enrollment. This is the time of year that you can make changes to your benefits. It's also a good time to confirm your dependents. So where you're having to fill out the new enrollment forms for the new carriers, just making sure that everybody's updated on those forms. And then also to verify and update your beneficiary forms. If you aren't making any changes to your life, you don't need to do anything. But if you've had a life change, maybe marriage, divorce, birth, and you needed to add anybody or take anybody off, this is a time to do that. You don't have to have open enrollment to make beneficiary changes. So if you have a qualifying event or you have something happen in December and you need to make the change on your beneficiary, you can do that at any time. This is just as a reminder. However, with your other benefits, please keep in mind that once open enrollment is done, whatever benefits you enroll in is how your benefits will be until June 1st of 2017, unless you have a qualifying event. So a qualifying event, again, is marriage, divorce, birth, death, adoption. That would allow you to open up a window for you to make a change to your benefits. So just be comfortable with whatever you decide to enroll in, because cost is not a reason to make a change. The IRS has very specific guidelines that you have to follow to make changes during off-season. As far as being eligible, you do have to work 30 hours a week. You can cover a lawful spouse or domestic partner. And you can also cover dependents up until age 26. That's something that's changed over the years. So they do not have to be a tax dependent. They don't have to be on your taxes, but just keep in mind that when you add those dependents, it's your dependent only, not their children and not their spouse. So as far as our carriers, we are going to be using Aetna for our medical, dental, and vision. And those of you that have been here for a little while might remember that you're with Aetna prior. So same thing, same company. BHS is still administering your health reimbursement arrangement. We'll go through how that works. HR Pro is still for your flexible spending account. And then US Able for your life and AD&D. Now, if you work for Home State, the Hartford is who does your life, AD&D, and long-term disability. So some of the definitions we like to touch on really briefly before we get started, just because they have so many words in insurance and it gets confusing. We have a copay. And so this is a fixed amount that you pay for a service. So for example, if I'm going into the doctor, somebody, okay, I'm like, wait, is there a question? If you go into the doctor, under this Aetna plan, it's a $25 copay. So you'd pay that $25 instead of paying the full amount for your visit. For a deductible, this is the amount that you pay out of your pocket annually before your insurance begins picking up. So under the plan that you have, it's a $5,000 deductible, but just remember, you have that health reimbursement arrangement that helps to keep that deductible lower. We'll go through that when we get to some of the future slides. So once you've met that deductible, you have coinsurance. So this is when you and the insurance company split the difference. So if you have a service done that is, say, $10,000, you pay the first $5,000, which is your deductible. Then the insurance pays for, under your plan, at 70%. And then you would pay for the other 30% until you reach your out-of-pocket maximum. So once you reach that annual out-of-pocket maximum, for an individual on your plan, it's $6,350. For the in-network charges, all the claims after that point are paid at 100%. We want to also stress the importance of using preferred providers because they do give you the biggest discounts. So you can see when you have an explanation of benefits and you see the discount on that form, they have an arrangement with the insurance company that helps to keep that cost down for you.
Can I ask you a question?
Sure.
If you've already met your out-of-pocket expense for this year with MODA,
Mm-hmm.
will that go over to Aetna?
So we do request a deductible credit report that will be sent over from MODA to Aetna so that you get credit for that. And that does take a little bit of time. So if you know that you have some services coming up, we do have Shelley with Aetna that can assist with that so that everything gets paid correctly after that June 1st date. So for usual, customary, and reasonable charges, this is a calculation that's done by the health plan for what a service should actually cost. So for example, before I have lab work done or I have an x-ray done, I call in and find out how much they're going to charge me. After I look at my providers, I set up my appointment based on the one that has the best cost. And the reason I do that is if I go into a provider and I'm getting an x-ray done and one facility charges $500 and the other one charges $1,000, and the usual and customary charge for that service is $500, the insurance carrier is only going to pay up to that $500. And so the additional amount is something that you can be bounce billed on. So some of you may have seen that in the past as a bounce billing. That's why it's important to ask those questions of your providers, your labs, so that you're not paying more than what you should be. Keeps your costs down, and it makes you a good consumer of your plan. It keeps your renewals down. So with Aetna, we have an open choice PPO. The individual deductibles is $5,000. This is the same as it was with your MODA plan, but with the HRA, I'll show you how that reduces your cost. It's $10,000 for family, which is the same as it was with MODA. 30% coinsurance. Your out-of-pocket max is $6,350 for individual, and family is $12,700. For your preventive care, that's covered in full. And I will be sending some information over to Oksana, a list of what those preventative services are because it's very extensive. So it's always nice to bring that list with you. For your office visits, it's a $25 copay. And when you're going in for your office visits, that deductible is waived. So some of you may be able to go to the doctor and always use that $25 copay and never touch your deductible. For your urgent care, it's 30% and the deductible is waived. And for your emergency care, it's also 30% with deductible waived. Again, as a reminder, please use your preferred providers. When you're going in for your preventative services, these are covered at 100%. Some of the questions that I like to remind people to ask when you go into your provider or you book your appointment, make sure that you mention that you're coming in for preventive. I always bring a copy of that preventive list with me so that there's no surprises. Because if the doctor recommends another test, maybe he's doing an expanded blood panel test, excuse me, that cost becomes yours and it falls on that deductible and it can get really, really expensive. So by asking those questions up front will help you to keep your costs down and not get an additional bill. Now, if it's a service that doesn't fall under preventive, it falls under diagnostic, that's where it becomes your deductible and coinsurance. And keep in mind that some of the tests are based on age. Some can be based on gender or family history. So maybe the recommended guideline says 40 for a colonoscopy, but you have colon cancer that runs in your family. By having that family history, sometimes it can be done as a preventive service at a younger age. So make sure you ask those questions. The doctors will know how many removed people you have to have, or if it's a sibling or a parent, as far as if it would fall under those clinical guidelines. You do have a prescription drug plan. So for your generics, it's $10. If you're doing preferred brand names, those are $30. And then your non-preferreds are $50. If you have a specialty drug, those are $30. And if it's a non-preferred specialty, those are $50. You can do a mail order. So if you have a maintenance drug that you're using, you can do mail order and get 3 months supply. That's always nice to not have to run to the pharmacy every month and get your prescriptions. And if it's out of network, just keep in mind that out of network, you cannot do mail order and it will cost you more. So make sure that you check to see who and which pharmacies are in network for you. And again, just as a reminder, generic drugs are FDA approved. A lot of the generic drugs do run 20 to 60% less in cost. So if you can go with the generic, please go that route. It keeps your costs down, keeps the cost of your plan down. So with Aetna, there's a few more additional benefits. You have routine eye exams. So every 12 months, you can go in and get your eye exam, and that's covered in full. If you are doing a hearing screening, if it's routine, those are covered in full. Make sure that with either one of these, it's in and not in network. So your deductible is waived. You don't have to pay that first $5,000. And then as far as your vision, you can cover up to $200 every 12 months. So that can be maybe your contacts, your lenses, your frames. If you go over that $200, it's out of pocket. So just keep that in mind. And this is included in your medical plan. One of the other things that Aetna offers is Teladoc, and this is virtual care. So I don't know if you guys have heard of Teladoc before. It's where you can receive service over the phone. They can do it over Skype, and it saves you from going into the doctor's office. So maybe you're not feeling good, you don't want to leave the house. This is an option for you. Keep in mind that it does cost you a copay, so you'll still pay the $25. But it is really nice to not always have to go in. They do not treat you for everything. It's more the bronchitis, allergies, maybe UTI. They can do those services over virtual care. They can also send the information to your provider so that they can continue care if needed. And if it's something they can't treat you for, they will recommend that you go into your doctor. And I'll make sure that there's a flyer sent over on this as well. There's also the Informed Health Line. This will be available on your card, the phone number. But the thing that I really like about the nurse lines is if I wake up at night, or if I have a little one that wakes up and they're not feeling well, and I don't know if I should go to the emergency room, I don't know what I should do, I can call that number and they'll say, get to the ER, or they'll say, this can wait until morning, try this. The other thing that's nice is if you're traveling, and you get sick, you don't know where to go, you can call that number and they'll tell you where the nearest provider is. They'll tell you how to get there. So it's really a great service to use, especially where it's free, it's confidential. It's just really a really nice benefit. And this is more of a reminder of it than anything else. Urgent cares are open later in the evening. They do cost less than going to the emergency room. You're not always going to be able to use an urgent care, but whenever possible, go that route. Now, as far as the different listing, this information is in your open enrollment guide. So if you just want to look it over in there, the information's there for you. We also have your medical HRA. So as I had talked about earlier, you have a $5,000 deductible, but with your health reimbursement arrangement, it makes that amount much less. How your HRA works is, let's say that somebody's hospitalized and they have the $10,000 bill. You would be responsible for the first $1,500. And then after that point, your HRA will pick up 80%, and you'd pay the other 20%. So with this example here, you would pay your $1,500, the HRA pays $2,800, and then you'd pay the other $700. So if you had met that that deductible amount of $5,000, your portion is actually $2,200. And then your reimbursement arrangement pays the other $2,800 back. If you have family, it's 2 times. So for a family, you would have $4,400 as your deductible amount. And then after that point, your coinsurance is yours. So coinsurance, the portion that is your cost is the $1,350. Your flexible spending account, this can be used towards any out-of-pocket expenses you might have, such as deductible. You might have some prescriptions that you want to cover, additional money set aside for glasses, contacts, dental. And this runs a little bit differently. This is effective on August 1st. So those of you that have used the flexible spending account in the past, that's normally when you do the enrollment for that. The thing that's really nice about this is the money does come out pre-tax. And if you sign up August 1st and you go on August 15th and you elected to have $1,500 annually put into your FSA, you have the full amount available to you right away. So it doesn't have to all be set aside now. This year it's going to run a little bit differently. Because we are going to do a shortened plan year. So keep that in mind when it comes time to enroll. They did increase the annual maximum. Before, you might remember it was at $2,000, and they bumped it up to $2,550, which is IRS limit. For the dependent care, that's still at the $5,000. And then next year when we do open enrollment, you will enroll at the same time as your medical. So it'll make it much easier for you to do everything at the same time during open enrollment rather than waiting until August for the FSA to take place again. Yes?
If we've already used up our 19 pool this year, we got 1992,
Mhm.
we really don't have access to that money until January 1st, right? That year.
They run years on a plan year rather than a calendar year. So the IRS limit is at $2,550. So the way that theirs runs is when it starts over on August 1st is when you'll be able to sign up again and have funds to use again.
The full amount,
Mm-hmm.
even if I use 1992 on it.
That's correct, because they go on what's deducted from your check, not the amount that you use out of that account. Yes.
Stephanie, can you just explain what this FSA is? Because some people in the room may not be aware of what that is.
Sure. It just stands for Flexible Spending Account, and it's used towards medical expenses or dental, vision. So if you know that you are going to have some out-of-pocket medical expenses this year, maybe you know you're having a surgery, you can elect to put aside up to $25.50 into your flexible spending account. The money is preloaded onto your card, and it can be used towards those expenses. So maybe you're doing a prescription every month that you know you're going to pay $50 for. You can elect to have $600 put aside for the year.
And then what that is pre-tax dollars.
It is, yep.
So you're not paying payroll tax on the funds for medical if you're electing to use this.
So it can be tax savings, you know, you're claiming $25.50 less in income for that year, which really can make a difference for you. But what I really like to stress on that is know how much that you're going to spend. Because one of the things that will happen is, let's say that I elect the full amount. I do the full $25.50. I thought I was going to have some procedures done or dental work, and I got to the end of the year. I can roll $500 into the next plan year, but anything else that I don't use for that year that I elected to put contributions aside is forfeited. So just really think about the amounts that work for you. I love having a flexible spending account. Usually when I go in and get my glasses or I have dental work done, if you have one root canal, it takes up your whole amount. Or if you do contacts and you need a pair of glasses, it helps you to put that money aside gradually rather than having to pay for it, all at once out of your own pocket. And then it helps with the
The
pre-taxing.
way they do it is they would have a certain amount deducted from each payroll check.
Correct. Yep, so it comes out each payroll, but it's available to you on August 1st. Do you guys have any questions on that? I know it's a lot to take in. I'll be available afterwards too to answer any questions that you have, or if you want to ask questions about how much is maybe good to set aside, I can absolutely help you with that. For the dependent care, it does work a little bit differently because you can elect the $5,000, but you do have to have the money put aside before you can elect to have it reimbursed. So it's nice where you can pre-tax up to $5,000, but I would need that money in my account before I file the reimbursement for it. And just as a reminder, keep copies of your receipts, your invoices, your explanations of benefits, because they will request that from time to time to audit and make sure that you're using the money appropriately. If I accidentally use my card for a purchase, because it works just like a debit card, and it's an ineligible expense, I do have to pay a 20% penalty. So just make sure that you are using it towards those services and medications that it's allowable for.
So your total annual contribution cannot be more than $5,000 per household, correct?
Correct.
And that would be for daycare, for schooling, this private school.
As long as they have a tax ID number or social that they provide you. That's a very good question, because if I bring my child to maybe my mom and she babysits, but I don't give her, it's not claimed as income for her, she just does it out of the goodness of her heart, I would not be able to file for my dependent care reimbursement because I'm not actually paying somebody that's licensed or somebody that is being 1099.
So with that amount, are we going to be required to use the debit card, or is there another way to get the reimbursement?
For the HRA? Okay. Oh, okay, so this is not tied to Aetna. This is separate. This is through.
We're going to continue on as we have been if we've been using it.
Correct. Yeah. No, that's a very good question. So the company for your flexible spending account is not changing this year. We may do a reevaluation on that next year, but as of right now, you will enroll for August 1st when it gets closer, and then it will be with the same company at this time. We are still offering a voluntary dental benefit. This is through Aetna. Your deductible is $50 for individual, and then $150 if you have family. So for your co-insurances, if you're doing your preventative, these are your cleanings, your exams. Those are covered at 100%, and you do not pay your deductible. If you're having a basic service done, your basic services would be something like a root canal. Maybe you're having a filling, an extraction. Those are covered at 80%. And then for your major services, those are 50%. And so major services, that crown that you have to have done after a root canal, might be dentures, bridges. Those fall under the 50% mark. And then every year your calendar maximum is $1,500. So it's nice this year because you're kind of, you're changing carriers mid-year. If you have any dental work that you need to get finished up this month under MODA, I would suggest it because you do have a $1,500 benefit with them. And then you'll have a new $1,500 benefit under Aetna. So if you know you have to have some stuff done, try to break it up a little bit this year. Get it done before the end of. So your life insurance, Homestate does have a little different benefit, so I'll go through everybody else's first. It's a flat $25,000. It does begin reducing in coverage at age 65, so just keep that in mind. And then it does terminate at retirement because it is a group life insurance product. You do not pay anything to have this coverage. It's covered for you. No deductions out of your check. Again, as a reminder, if you don't know who your beneficiary is, go ahead and get that changed so that you keep track of it. It's happened many times before. For Homestate, they have a little different benefit from when they came over from their old plan. So theirs is at a $50,000. The age reduction schedule is the same. At age 65, it starts reducing, and you pay nothing for this coverage. We do have long-term disability. This is for the Homestate folks. Benefits do begin after 90 days. It's 60% of monthly earnings, up to $10,000 per month, and that does end at normal Social Security retirement age, which some people maybe 65, some at age 67. There's no cost to the Homestate folks for this one. And then as far as your monthly premium costs, there was a decision made to go with a different carrier because we did have a very sizable increase with MODA. And so they decided to switch over to Aetna so that the cost could be kept down. These will be the breakouts for the medical and RX. And then below you'll see the voluntary dental. You don't have to worry about necessarily writing these down. In your open enrollment guide, the ones that came out to you guys. Oh, thank you. Yep. So the amounts will be on that page if you need to review those with your family or your other half. Some of the reminders I want to run through with you really briefly. If you have any prescriptions that you currently take, please try to get those refilled by the end of the month. When we're switching carriers, there's always, there can be a little bit of a lag time from getting your new cards. And so I just want you all to be aware that it is best to get that filled so you're not waking up on the 1st, you forgot to fill your prescription, and then you're having to pay out of pocket until you get your new card. Please just have that filled before the end of the month. If you are currently scheduled for a surgery after the month of May, or if you're receiving some more complex care, we can do a continuation of care. And if you need that help or that assistance, let Oksana know so she can contact us so we can get you in contact with Aetna. We work with a gal named Shelly through Aetna. She's your account manager, and she is awesome. She will take very good care of you if you're having to go with the continuation of care. Please turn all your paperwork in as timely as possible. The sooner we get the paperwork back, the sooner we can get that off to Aetna, the the sooner you'll get your cards. One of the things that we will do is once everybody's enrollment's loaded, you may not have an actual physical card, but we'll send out the instructions on how to get a temporary electronic card. You can continue care if you need to. And then for your HRA reimbursement, with MODA, it was automatic. So with Benefit Help Solutions, they automatically process those HRA reimbursements. If you have a reimbursement to file for, there will now be a paper claim. And so Oksana, I'm not sure where you guys will be housing those forms. Probably on the internet. Yeah. So you'll be able to access those forms. It's a page, you fill out your name, address, you supply your explanation of benefits or receipts, and then they reimburse on that deductible. So please let us know if you have any questions on that.
I wanted to add something. She's mentioned that the reason we moved in carriers was because of cost. That wasn't the only reasons. Everyone's heard about MODA in the news over and over. And what we didn't want to do is keep our coverage with MODA, who had a huge increase, and it go away midstream. So you don't want to be with a bankrupt company. So we just said, well, that's too iffy for us. So we went with Aetna, who is a very reputable and has actually grown exponentially with having many more, what did you say, partners? What do you call that, doctor?
The
hospital,
providers, the preferred.
The preferred providers. So they were a real strong company. And then there was another thing that was really important when we were comparing, say, Blue Cross to Aetna. You know, what we're finding is a lot of spouses have their own coverage, but a lot of our female employees have their children on their plans. And we really liked the cost for the children, which was much less than some of the other offers. So we said, okay, so we have single moms that are covering the children. And so we that's another big push for us to go with that. So, you know, with any insurance company, it's you really need them when you need them. But we tried to consider your out-of-pocket costs in the whole matter. So those were some of the
Thank you, Naomi.
I thought I should share that.
So these are the contact information for the different carriers. This is also included in your enrollment guide. So don't worry about writing these down. They're right there for you. And then the team at the Wilson Agency, again, I'm Stephanie Roslin. I'm an advisor. We have Leslie Shelton, who works as an account manager. And Leslie's role at the Wilson Agency is to help with client advocacy. So if you've had a claim that hasn't paid and you need assistance with that, she's able to do that for you. But one of the things that she will ask you when you call is, have you contacted the carrier? So if you're having a claim issue, we do ask that you call into Aetna or MODA prior, because we can't get any information until you've done that initial call. So please keep that in mind. We also have Terry Allard, who's a senior advisor on your account. She's awesome. She helps put together all the information for the renewals. And so we're all here to help you. We know that it's always hard when you're making a transition and you're changing to new carriers, but we would like to assist in any way. So if you have any questions after the session you'd like to ask me in private, or maybe you don't think of it today, please let us know and we'll help guide you. So that's all I have. Is there any questions you want to ask now, or do you want to just wait and ask privately? I'm open to either. That's a good question. We'll go ahead and we're sending a bunch of flyers over to Donna. And so there is information on how to access those providers. And so you can do it online. I always recommend looking at your providers online because they do change all the time. Another thing to do is to call your provider that you go to. So if you have a certain doctor you go to at this time, just say, hey, do you take Aetna? Chances are they do, because most of the, they've really, as Naomi had said, they've really stepped up in the marketplace over the years. because of the state contracts. So they have a lot of providers now that are in network.
And so everyone knows, I don't know if you had mentioned it before I came in, but Providence Hospital is the preferred hospital. So, and Valley, which,
Matt Valley Regional,
okay. So,
same as Moda.
same as
Moda's.
Moda, so there were a lot of similarities also.
And it was nice where we could have a similar plan that you had with Moda by going with Aetna. It was nice we were able to line that up. Anybody else?
You said that you have the teledoc you
Mhm.
call, and then they can sometimes help people don't get your traditional copay,
Mhm.
and then sometimes they would refer you to go into the doctor. Would you then have a second copay for going into the doctor?
Now, normally what would happen is if it's something they can't treat you for, they're going to let you know that up front.
Before the copay?
Yeah. Because a lot of times it's very limited as far as what they can treat you over the phone, but some of those common things they can absolutely do. It doesn't mean you're going to get a prescription. So we have had people ask that they don't feel well. They're pretty good at what they do. So it doesn't always mean that you're going to get an antibiotic by calling Teladoc rather than going into the clinic. So it just as a good reminder.
But they can give you a prescription.
Mhm. Absolutely. No, it's a limitation. None of the stage what drugs are those, but they can prescribe. So if it's maybe I'm calling in and they know that I have an allergy, there's been people that have called in because they have a skin allergy, and they're able to order the salve for them. So it works out really nice if you don't want to leave the house. So sometimes you get sicker by going to the doctor than doing it from home. Anybody else? Well, that's all I have for you. Again, please try to get those forms turned in as fast as you can so they can get everything processed and so we can get your cards out. There'll be some other flyers and information that's coming your way so that you know how to go online and look at your electronic card, how to access the providers. So that'll be coming out as well. The which forms?